Hey everyone, it's Dr. David here. I am live here on YouTube. Thanks for those of you that are joining us live. It looks like we've got two. I'm sure we'll get more people jumping on here. Just to let you know, we're going to be talking today about ACL injuries, ACL tears, which is a ligament inside the knee. And I'm going to be answering the question, is it better to let an ACL tear heal naturally, or should you be getting knee surgery for this problem? So I'll be talking more about that. But before I go into it, everyone that's here, just let me know where you're from and let me know if you can hear me. I'll type that in the chat here. Let me know if you can hear me. Let me know. Tell me where you're from. All right. So as always, here on the live streams, if you're catching us here for the first time or on a replay, you can jump in on the chat here and just let me know if you have a question. I'm happy to answer it. I have content I'm going to be talking about. Obviously, today's going to be about ACLs and whether or not you need a surgery. But if you have a specific question about other knee problems or any problems, back, neck, shoulders, hip, knees, ankles, feet, any of that stuff, elbows, hands, wrists. I'm happy to talk about all that and answer your questions during the time that we've got today. I've got about 20 minutes today, so it's going to be a little bit shorter than normal, but I'm still going to bring the heat. Nubby Rose gives us a thumbs up, and from San Antonio, hey, fellow Texan. Thanks for joining us, Nubby Rose. I love San Antonio so much. I love visiting out there. The Riverwalk is such a beautiful place to hang out. I had a burger at Chris Madrid's. That was fantastic. And the puffy tacos are pretty good. I do have to say, though, sorry, Nubby knows, El Paso's tacos are just a couple notches better than San Antonio. But that's a debate for all Texans. Where are the best tacos from? Molly McGregor says, Northern Illinois, we need you up here. Oh, I've been to Chicago. That's kind of Northern Illinois, right? I wish I could go out there. Molly McGregor. Chicago was beautiful, big place. Loved it so much. I can't wait. I would go in the summer only though, because I went in July. I believe it was July, and it was beautiful. The weather was great. I hear terrible things about the winter though. I love being down in the South. I'm right by the border, near Mexico. It's always sunny out here. Actually, today, just to give you a heads up, my internet might cut out. The wind is it's blasting outside, and our internet has kind of gone in and out. It's actually raining, but it's like this 1 or 2 days out of the year. Okay, maybe like 5 or 6 days out of the year. In El Paso, it's mostly sunny. In fact, they call it the Sun City. So I love being out here in El Paso. Lee, Virginia. Hi, Dr. Virginia here from Hong Kong. I think I remember you, Lee. You've commented before on, or I don't know if you were on a live stream or you commented before. Oh, I'm so glad. Lee Virginia says, you helped me a lot on my knees. I'm so happy that we've been able to help you out. I love doing this, by the way. For those of you that are on here and want to say thank you for all the content we put out, don't be shy. It helps you to leave comments on our videos. Just say thank you. If you can leave like a paragraph about what's been going on in your life with your knees, especially if you've been to other doctors or you've tried physical therapy, you've tried other things, and it just hasn't quite worked for you. If you found that our stuff, my tips and advice have helped you out, put something on there, because the people that find our videos on YouTube or anywhere else on the internet, they need to see that and hear that we have some helpful information. So the more the better. I appreciate it. Thank you so much for joining us, Lee, Virginia. I think you go by Lee, if I'm not mistaken. Let's get into the content today. So we're going to talk about our ACLs. If you have an ACL tear, do you let it heal naturally, or do you need to get a surgery? And this question was spurred on from the comment from Nithin Fahumedeen. I'm going to rip up the name. I'm so sorry. Nithin Fahumedeen. He said, hey, bro, even if it is a partial tear, if it heals, the elasticity of the ACL is gone, right? Which is equal to instability. Also, the synovial fluid in the ACL prevents the formation of clot, thus preventing healing. I don't know. I read from various articles. So Nithin is trying to figure out if ACL tears, when they heal, are they loose? Do they are they unstable afterwards? And can they even heal? Which leads to the questions: do you need surgery or not? Because we know that ACL surgeries tend to be pretty effective. Tend to, you have your situations that don't work out too well, but a lot of people that have ACL surgeries for the most part do pretty well. But then there's always the question of, is it even necessary? Do I need to put myself through that? Because it's about a year-long rehabilitation process. And if you've seen a doctor for your ACL problem, like a surgeon, and they've told you, oh, you'll be like 3 months, 6 months, just double or triple whatever they tell you. For any knee surgery, that's the case. Knee replacements, meniscus surgeries, like a meniscectomy, we hear that from doctors all the time. Oh, you'll just be down for about a month or two. You'll be walking the first day after surgery, and then you'll be dancing by 3 months out. That's rarely the case. It really is. And if you had that experience, you're the outlier. You're the one in a thousand or more people that have had that type of surgery that are actually dancing 3 months later. Most people are still having weakness, stiffness, lots of stiffness, pain. They're just dealing with problems for months and months after, and they feel bad because the doctor said just a few months, and it's been more than that, and they're still having a lot of trouble. So don't feel bad. It takes like a year. So do you want to subject yourself to that? If you have to have an ACL surgery, do you need to put up with a year's worth of rehabilitation afterwards? And is it possible to go on without? Now, there's a growing body of scientific medical research showing that it is possible naturally without an ACL. Let me backtrack on that. Let me get my words 100% straight. There's no proof, there's no scientific evidence that the ACL heals. That doesn't mean that it doesn't happen. We just don't have any notable studies that show that. And a lot of people in the medical field just say, well, we don't have any studies that show it, so therefore it must not be true. It can't happen. But it's just, we don't know. We have no idea. It hasn't been studied. What we see clinically, though, in other words, like as a therapist in the clinic, what I see is people get back to normal after having sustained a partial ACL tear, possibly a full ACL tear. Now, so to go back on my statement, let me revise it just a bit. People can get back to normal activities after having an ACL tear. It's questionable whether or not the ACL heals or not. I have not had any patients go back for a follow-up MRI to check on their ACL to see if it's healed. That being said, an MRI is it's magnetic resonance imaging, so it's a way of looking at the inside of the body at things like ACLs without cutting you open. There's room for error there, and there have been studies that show that there's a rate of false positives, meaning on an MRI, they do an MRI for people's ACL, and they find that it's torn according to the MRI, but then they go in to do the ACL repair surgery, and they find that it's actually not torn. It was actually connected. And so the surgeon's left in an ethical dilemma. Do I just close them back up and call it a day and tell the patient, sorry to open you up, the MRI read you wrong, you didn't actually need an ACL surgery? People have had this happen. If you're on here and this has happened to you, chime in and say something on the chat here. But I've heard of patients come back and say, you know what, the surgeon told me I had a intact, a connected ACL. So because they were already in there and I was having ACL tear symptoms, they went ahead and cut my ACL and surgically repaired it to leave it stronger than it was before. That leaves a patient thinking later on, well, why did I even sign up for surgery? I could have just healed on my own. Did I jump the gun too fast? So here's my recommendation for Nithin, the gentleman or ma'am. I'm not sure if you're a male or female. I'm so sorry. The person that commented on our video here, which he commented on a video about how to test and heal a torn ACL and heal without surgery, which I've linked in the description below here. To answer the question is, I would give it a go on letting it recover without surgery. What I mean by this, if you've sustained an ACL tear, you're probably going to get your knee all swollen. You're going to lose motion. You're not going to be able to bend your knee or straighten out your knee. You're not going to be able to put your weight through it normally. This is a true ACL tear. Like I've seen people that have had a legitimate ACL tear The MRI was an obvious ACL tear. The surgeon did the surgery repair afterwards, and they confirmed that it was an ACL tear. And when I saw them before they had their surgery, it was pretty clear how they presented. Big swollen knee. Sometimes it even gets bruised. It looks black and purple. And they just the accident, they were in a sports accident and somebody fell into the outside of the leg and they just bent their leg funny. Or they were playing sports and had a funny step and they'd been having knee pain leading up to it and they felt a pop. That's the classic ACL sign. Did you feel a pop? The surgeon will always ask, did you feel a pop when you got hurt? Because that's the ACL popping when it breaks. If you can let that swelling calm down by getting off your feet, by using crutches for a while, gradually stretching to gain some motion, maybe even going to go see a physical therapist in person or doing some exercises or stretches to gain the mobility back and get the swelling down. If the swelling goes down and you start to gain motion and your pain also reduces, it's looking like it's improving. That's a situation where you might be able to recover just fine. Now, what's going to happen if you have a true ACL tear is you're going to have instability. That's what Nithin was referring to in his comments. And what I mean by that is let me bring my skeleton over and angle this down just a bit. In the knee joint here, the ACL runs deep inside the knee and it connects the thigh bone to the shin bone right in here. It's one of the main connections along with some other main ligaments. But if you lose the connection of that ACL, this joint now becomes loose or unstable. That's what that means, that instability. And so if the ACL can reconnect or heal, we don't know how it happens, if it happens, but clinically we see people that improve. Then in theory, what Nithin is asking is that healed ACL now going to be looser than before? And does it leave you susceptible to another ACL tear or other problems that arise? Nithin didn't ask this, but I get these questions all the time. Am I more likely to get arthritis later on? So here's my response, my like full response to this. If you can heal, if your swelling goes down, your bruising goes away, your mobility comes back, your ability to put weight on it and start to walk normally again, now it's time to strengthen your muscles. Usually there's some muscle imbalance that led up to this. If you had an accident, that's different. But if you had recurring knee pain and then you kind of took a funny step, you were playing sports or exercising or you fell and then it popped and it wasn't like a big fall, then there's probably some muscle imbalance that you're dealing with, and you've got to correct that muscle imbalance in order to prevent the ACL from rupturing again, or in order to allow it to heal all the way too. And the number one muscle imbalance, let me just show you the movement that occurs. If you've got weak glutes, this is the same muscle imbalance that affects knee arthritis, meniscus tears, patellofemoral pain syndrome. The ACL is designed to stop your knee joint from going too far in this direction. So every time your knee bends in this direction, you're stretching your ACL. So if you have an ACL injury, you need to keep your knee straight like this and prevent it from going this direction. So it is critical, if you're recovering from an ACL tear, it is critical that you use a knee brace with brackets on the side. In fact, I have one right here. Something like this works really well. And I forgot to link it in the description right now, but it'll be the link will be up here in the next few minutes after I finish this video. These braces are awesome. And you don't have to get this brand if you have an ACL tear, but if just find a brace that has stiff bars. I can't take it out on this one, but in there in the fabric, there's a stiff bar with hinges. It's got dual hinges, meaning it's got two hinges in there. And so when you put this brace on your leg, it keeps your knee from bending sideways too much, and it helps to take the load off your ACL so that it can heal. If you think of the ACL as like skin, like if you were to cut your skin right here, if you had like a straight cut this way and the edges start to come apart, you need to put the edges together in order for that to heal the best. If you keep pulling your skin inadvertently as it's healing, well, guess what? It's going to reopen and re-injure it. And ideally, you need to get some stitches to pull it together, or some stereo strips, some like little sticker things that you can use to pull your skin together. And you need to protect that and let it heal as fast as possible. Well, if you're feeling better in your ACL and then you go do activity that's going to stress your ACL, it's just not going to heal. And then an instability can occur. Now, the theory that we're operating under is when you lay down scar tissue, meaning like just like in your skin, if you get a scar in your ACL, if this is your ACL, just to give you an image, and you let's say you get a partial tear, you still have a few strands that are connected and these got torn, your body will want to reconnect those and fill that space in with scar tissue. That scar tissue is theoretically about 60, 70, 80% as strong as your original ligament tissue. That's pretty good. I'll take that. And as long as you're protecting that ACL from getting retorn, by not letting your knee go inwards like this, then you're going to be just fine and you can heal naturally without having surgery. Now, having a full tear, I can't say that, that it'll heal or not. Personally, I've had the experience as a physical therapist working with people that did not want to go to the surgeon here in town. I've checked their knee out and I've said, this feels like a complete tear. The MRI confirms a complete tear, but there might be false positives. I don't know. And we've gone through the protocol that I take people through, which is like what I've already talked about, let the swelling go down. Let's get the mobility back. Let's start strengthening all the muscles at the foot and the knee and the hip. And let's protect that ACL with a knee brace. And I make people wear the knee brace as long as it takes. I'm checking their ligament most visits when they come in, and I can feel that the ligament is tightening up, which is the way it's supposed to be. It shouldn't have a whole lot of elasticity. It should be a stiff ligament that checks the motion. It stops the motion from occurring at that end point in the knee joint. If all that's going on, then you're getting better and better, and you have escaped surgery. I would wear this thing as long as it takes. I had a knee injury myself, and I had to wear one of these things for 10 months. Who cares? If the doctor says put it on for 2 months and then come by and see me, if you're not 100% better, then let's operate. I'm going to say no. Hey, if I got 10% better wearing this for 2 months, who's to say that it's not going to get another 10% in another 10 months? I'm going to keep going until this stops helping me. And as I've seen with patients wearing the knee brace, it just continually helps them as they move along. It may not be fast, but if they can avoid getting an infection from a surgery, or maybe they didn't even need a surgery to begin with, that's, in my opinion, that's the worst news when you get cut open and the doctor says, oh, everything was actually connected. I mean, they wouldn't have known. They're following the MRI. They're doing the best they can with the tools that they have, and they just have to report what they see and then do the best by the patient once they're in the operating table. But once you're there, they got to do something. So that's how I would answer the question. To be super direct and concise, a partial tear can heal, in my experience. And if you allow it to heal correctly by not overstretching it and getting some extra support from like a brace like this, making sure you strengthen and you move better, then you should not have an instability. When I treat people here in the clinic, as long as they're following instructions, which they mostly do, they do not have instabilities by the time we're done with them after an ACL or some other ligament tear. And then as far as the synovial fluid is the fluid inside the joint. That's what Nithin was asking about on the comment. It's the fluid inside the joint that's made within the joint capsule. And its job is to cushion the joint, to put a little bit of space in the joint, and to nourish the tissues inside the joint. Now, I don't know off the top of my head if the synovial fluid nourishes the ACL. I know the ligaments do have blood vessels going to them. They just heal slower because they're lower metabolic tissue, meaning they don't have as strong of a blood supply as like your skin or muscles or tissues that are red in the body. But they do heal, but it's largely dependent on the forces you put through them. If you give them their time, they will heal. What else did he say here? He read from various articles. Yeah, there's just isn't a whole lot of research on whether or not they heal by themselves. So I have a few more questions to answer, like on arthritis and all that. But let me just get some comments here, and then I'll come back to those. All right, Raji Gopal says, Raji from New Jersey, your videos have been a great help. Fantastic, Raji. I'm great that we've been able to help you out. Nubby Rose says, torn meniscus in May 2020. Oh, so sorry. No surgery, just exercising. I'm not back to pre-tear knee, but I can walk, but my knee starts to hurt after 45 to 60 minutes. Well, that's pretty good. So I can't walk far like I used to. Okay, good. So it looks like you're headed in the right direction, Nebby Rose. Oh, and you got another comment down here. Let me see if I can connect them. Torn meniscus in my left knee, and then after a few months, my right hip started to hurt. My knee has improved, but not my hip. Ah, I'm so sorry. It sounds like you probably have a muscle imbalance, like the weak glutes, dominant quads. And that might be your limiting factors. You need to just get stronger in the glutes. And a lot of people underestimate how strong you need to be in your glutes. I tell people you need to be able to do squats, hold them. It doesn't have to be deep either. If you just do a partial squat and you can hold it there with some weight, and I'm talking significant weight, like 25, 35 pounds or 45 pounds. It depends on your body weight, your size, your activity, how big you are, how tall you are, your frame. You might be a skinny person or a thicker person. Um, all those factors. To put it succinctly, the intensity for you on a 0 to 10 scale of what's a 10 for you would be like the most intense activity that you've ever done when you're strengthening, and a 0 is nothing. When you go to strengthen your muscles, your glutes, you should be working at like a 6, 7, or 8 zone. If you're working anything lower than that, you're probably not strengthening enough in your glutes to offload the knee joint so that you're allowing the meniscus to heal fully and increasing the time that you can walk. I hope that makes sense, Nebby Rose. So you probably could extend your walking time. You just have to really depressurize your knee joint by getting your glutes stronger. And then you might need to look at your foot muscles as well. Your ankles could be an issue as well. So those things combined could allow you to really get to the next level and break through so that you can feel comfortable walking more than an hour. But it is possible. We see people like that all the time. People that are doing better, but they're still limited by a few things. Like they want to, here in El Paso, hiking is a big deal. So people want to go hiking in the mountains here, and they can walk around the block, they can walk in the park, anywhere where it's flat, even ground, no problem. But as soon as they get to the uneven terrain, and our hikes here are more like climbing because it's on a mountain. They have a lot of trouble in there, and it's because they don't have enough strength to tolerate that. But if you get enough strength, then you can usually bump up a few levels and tolerate more walking. All right, we have time for just another question or two, and then I got to get going here. Deepya retracted a message. Oh, don't be shy. Raji Gopal says, my knee pain has been there for about 8 months. The PT felt it could be due to my flat foot. Got my orthotics with orthopedic shoes, but now the pain is on my hips and knees when I walk, especially. Yeah, the orthotics can help. And we'll be making more videos about orthotics in the future. That's something that we haven't even dug into. We like to be thorough with everything that we're putting out. But with the orthotics, there's two types of flat feet. There's functional flat foot and then a structural flat foot. If you have a structural flat foot, that means your foot's always flat. Even when you pick it up off the ground, it stays flat. But if you have a functional flat foot, you should have a little bit of an arch when you pick up your foot, but then when you stand on it, it starts to flatten out. If you have a functional flat foot, meaning you put your weight through your foot and then your foot starts to flatten out, there's usually weak muscles in the foot that are not supporting the arch. And if you get those muscles stronger, you can now start to support the arch, because you can't rely on the orthotics. If you can address that, it usually helps to depressurize the knee. And then if you're strengthening the glutes along with the foot muscles, then you'll be in a better position to get the hip pain to come down, and definitely the knee pain as well. But Raji, it sounds like you're kind of in the same boat as Nubby Rose. You've got to get stronger glutes. I can't stress it enough how important how important glutes are in depressurizing the knee to avoid meniscus tears, to make sure that you're moving correctly. Because if you're dominating your quads, it makes your knee go inwards, like I was showing you, which is going to tension your ACL. It's one of the most common problems that we see. Going back to ACLs with like high school athletes, people that are in jumping sports and cutting sports. So like your volleyball, basketball, soccer, those are the big three that we run into a lot of ACL tears that are not an accident. Because you hear about it in football, like American football, but it's usually somebody fell into their leg and it was an accident. It was a collision of some sort that caused the ACL tear. But if nobody was around you and you took a bad step and you tore your ACL, that means that you've got some muscle imbalance or some movement problem or a combination of the two, where your knee is going inwards way too much. And it's usually dominant quads that leads a charge on that. And in order to calm down those quads, you got to get stronger in the glutes and the backside of the hip. Getting those glutes stronger and also looking at the foot strength is what gets the quads to calm down and then depressurizes the knee. The quads, when they're overactive, those quads, they all attach to the kneecap right here. And then that kneecap has a tendon or ligament, depending on what book you're looking at, that attaches to here. And so this muscle, the quads right here, are really strong and tight. They're pulling this up, which pulls this tendon up, which pressurizes the knee joint and smashes your poor meniscus in here, your cartilage behind the kneecap and on the end of the thigh bone right here. And then during movement, it causes that inward motion in the hip that tensions the ACL. So it just is a disaster if you have over dominant quads. You need to think about having more dominant glutes. All right, folks, that's all the time I have for you today. We'll be doing these live streams every Monday as long as you don't have any emergencies or special situations that come up. So if you're catching us on the replay here, join us again. And we're looking at doing these consistently at 4 p.m. Mountain Standard Time. So we'll look at scheduling them. So if you're looking to catch us live, so you can ask us a question, just check on our community tab. And you can see which videos we've scheduled on there. So as best as I can, I'm going to schedule those out. But those are likely the times we're going to be doing these live streams. Nubby Rose says, thank you. Raji Gopal says, I do the glute strengthening. It does improve, but it again pains in the knees after a few hours. So how many times and how long am I doing the therapy in a day? Great question, Raji. You got to keep going. Strengthening is not an overnight thing. Months, the better part of a year. You're looking at like 9 to 12 months to fix a muscle imbalance. It's something I don't mention a whole lot. So I'm glad that you mentioned that. You need to strengthen those glutes for months to break out of that muscle imbalance. And you need to make sure your glutes are dominant. That you use your glutes when walking, when going up and down stairs, when any exercises that you do, you should think about using your glutes. If you go on a long walk, you need to look at getting your glutes very tired afterwards. Even if it's a short, fast walk, get your glutes tired. If you go in the store, make sure you're using your glutes. If you're doing chores at home, you're washing the dishes or you're doing the laundry or you're cleaning the house, whatever it is, see if your glutes will get tired. If it's not, you're probably using your quads and feeding into the imbalance. You need to get obsessed with making those glutes work. That's going to be the number one way to fix this muscle imbalance. And you got to be patient with the strength. It never, ever goes as fast as anybody wants it. Every knee patient that comes in here that I'm telling to strengthen their glutes, I always have to tell them it's going to go slow and you have to start here and you have to progress. You can't expect to do the same single exercise for those 9 to 12 months. You have to start with one. Then once that one gets easy, move to the harder one. And then once that one gets easy, move to an even harder one. You add weights to it and you just keep going. You have to keep going like that. So hang in there, Raji. I hope that helps. All right, friends. Thanks so much for watching and catch us in another video. We'll see you next time. Bye-bye.